Hi, I'm Dr. Castle. I'm a veterinarian here at DePorre, and today we're going to talk about dog vaccines. Here at DePorre, we offer 6 different vaccines for your dogs to help keep them protected throughout their life. The 3 core vaccines that we recommend for all dogs, regardless of their lifestyle, is rabies, distemper, and the leptospirosis vaccine. We also recommend 3 non-core vaccines based on your dog's lifestyle. These include Bordetella, canine influenza virus, and the Lyme vaccine. Rabies is a fatal viral disease. It's zoonotic, meaning that if your dog gets infected with it, it can be passed to yourself or your family members. Rabies is transmitted most commonly through bite wounds, and it can be from animals such as bat, skunk, raccoons, or other infected dogs, or even cats. Although rare, there are cases that have been reported in North America and specifically in the Midwest, which is why it's absolutely crucial to keep your dog protected against this disease. The rabies vaccine is required by law in the state of Michigan. The second core vaccine is a vaccine called distemper, which protects against distemper virus. Distemper is a highly contagious viral disease that is incurable and often fatal. Distemper is spread by direct contact, but it can also be spread through bodily fluids such as respiratory droplets, saliva, sneezing, or even urine. Our third core vaccine is for leptospirosis, and this can actually be given in combination with our distemper vaccine. We do have a video on leptospirosis if you'd like to learn more about it. Bordetella is a non-core vaccine that we recommend for all of our canine friends that are in very social settings, such as doggy daycare, grooming, dog parks, or boarding facilities. The Bordetella vaccine helps to prevent and reduce the severity of kennel cough. Kennel cough is a broad term that's used to describe a variety of highly contagious upper respiratory infections. Kennel cough is easily spread in highly populated areas through direct contact, aerosol droplets, or even inanimate objects. The second core non-vaccine that we offer here at DePorre is for canine influenza virus. Similar to the Bordetella vaccine, we recommend this vaccine for dogs that are in highly populated areas where they'll be having social interaction with other dogs. Canine influenza is easily spread among dogs in highly populated areas through direct contact, respiratory secretions, or even inanimate objects. This vaccine works to help reduce the severity and duration of disease if your dog were to become infected. The Lyme vaccine is our third non-core vaccine that we offer. We highly recommend this in dogs that spend a lot of time outdoors in wooded areas or in tall grassy areas. This vaccine helps to not only prevent Lyme disease, but also in dogs that have been previously infected with Lyme disease, help to reduce the risk for reinfection as well. In addition to staying current on your monthly flea and tick prevention, we highly recommend this vaccine for dogs that are spending a lot of time outdoors or spending a lot of time specifically in wooded areas or tall grassy areas. As with any sort of medication or medical procedure, there are side effects that are associated with vaccines. The most common vaccine reactions that we see are swelling at the injection site or being a little bit more tired after vaccination. These are typically very mild and resolve within 12 to 24 hours of vaccination. Although rare, there are more serious side effects to vaccinations, such as facial swelling, hives, vomiting, diarrhea, and sometimes even difficulty breathing. However, our team works very close to monitor your pet after vaccination and treat appropriately if a reaction does occur. An overwhelmingly majority of our patients will not experience an adverse reaction to vaccines throughout their life. Vaccines are highly effective and essential for helping to keep your pet safe and protect against these potentially fatal diseases. Your new puppy should receive their first vaccine around 6 weeks old. At this first visit, your veterinarian will work very close with you to determine the vaccination schedule for your puppy moving forward. Our vaccination schedule for puppies typically concludes at around 16 weeks with the rabies vaccine. Boostering vaccines is essential for helping to ensure immunity and protection for your pets. While each vaccine varies, typically our boosters are recommended recommended once a year or once every 3 years. Typically, the leptospirosis and the Bordetella vaccine require a booster every year. Our puppy vaccines are a little bit different and require more frequent boostering, something that your veterinarian will talk to you about at their first puppy visit. If your dog is sick and also due for vaccines, we likely will recommend holding off on vaccines until your pet is feeling better. This will allow for their immune system to be able to create an appropriate response to the vaccination and provide the appropriate amount of protection. If you happen to miss your dog's vaccine appointment, it's very important that you reschedule this to ensure that your dog remains protected against these diseases. If you have any questions about vaccines for your dog, feel free to give us a call. If you're looking to schedule an appointment, you can always give us a call or schedule using our online booking.